Good morning. It's Sunday, March 22nd. I'm Velshi. Around the world, COVID-19 continues its attack on humanity. In Italy, the numbers are shocking. 793 people died in a 24-hour period, and 6,557 new COVID-19 cases were reported. Now, that is despite the lockdown that's been in place for weeks, which officials say is being routinely ignored. Here in the United States, there are now more than 24,000 confirmed cases of COVID-19. At least 297 people have lost their lives. New York State itself now has almost half of all the cases in the country. Congress continues to negotiate a colossal stimulus package, which the White House says could cost more than $2 trillion. Congressional leaders are set to meet once again later this morning. And despite being the wealthiest nation on earth, hospitals and medical workers continue to sound the alarm that we are in imminent danger of running out of vital medical supplies and equipment. The American Hospital Association estimates that some hospitals are losing up to $1 million a day and rising. They are now seeking emergency credit and pressing Washington for a $100 billion stabilization fund. But despite the dire situation, President Trump says supplies should be left to the highest bidder and that the federal government and states are in competition.
On your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators, get it to the most areas of need, and control the pricing to keep it at a market level so it's not price gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not?
Because we have so many companies making so many products. They're going to go on the open market. We want them on the open market from the standpoint of pricing. Because otherwise, it's going to be, we could be very unfairly
direct them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first.
For a governor who needs equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out.
There should be no bidding. Joining me now and throughout the show, senior columnist at the Intercept, the host of the Deconstructed podcast, and my friend and colleague Mehdi Hasan, clinical assistant professor at NYU Langone Health, Dr. Lipi Roy. She's also a medical contributor for MSNBC. Thank you to both of you for joining us. Dr. Roy, let me start with you. 2 days ago, the president said to Yamiche Sindor at PBS that anyone who needs a test in this country can get a COVID-19 test, not just because you want one, because you display the symptoms necessary. We have spoken to patients and doctors in the last 24 hours who have now said that is entirely a lie, or the president needs to get rid of everybody around him who's telling him so, because it's simply not true.
Good morning, Ali. First of all, how are you doing? I hope you're doing okay.
We're okay, thank you.
Okay,
we're coming to you. I'm coming to you from my home for the first time in the entire 30 years I've been in this business. So everything is unusual.
Everything's unprecedented right now. Okay, so let's be really clear. Right now, we have a shortage of almost everything, from basic items such as gloves and masks and gowns, like basic items that doctors and nurses and healthcare professionals need to protect themselves, let alone the patients. But testing is something that, as everyone now knows, it's been so slow to roll out. We are really at a shortage. So we're at a place where we can't just have anybody go get tested. Those are not the criteria right now. The criteria are for only people who are symptomatic, fever, cough, shortness of breath, to be getting tested. Because remember, it's not just about a matter of lack of tests. It's a matter of the people that they're going to be seeing who are going to be doing the tests. Healthcare professionals need to don full protective equipment, which we are in sore shortage of. So that's why this is really critical.
Mehdi Hasan, the president said 2 days ago, the government's not in the shipping business. We shouldn't be involved in procuring things. We don't need to be directing factories to make the masks and the respirators and all the gear that we need. We've heard from hospitals to say they're on their last few dozen swabs in some cases. We've heard from the VA yesterday saying they don't have enough testing for people available. We've heard from doctors who are saying they're reusing masks. This business about the government being in competition with states and every man for himself, poses a few problems, including that in which states will buy everything that's on the market for the most money that they can pay for it so that they've got it. So we're not going to get accurate and efficient distribution of this. This is just not the way this should be running.
The idea that you rely on the old-fashioned free market in a time of national emergency and a pandemic is absurd. I haven't heard anyone explain why he has not invoked the Defense Production Act yet to compel companies to start upping their manufacture of masks, of ventilators, of gowns, of all those essential materials that the world's richest country is now sorely lacking. He's talked about it. He's tweeted about it. He hasn't done it. I honestly don't know why. But then again, who would have guessed that if you put a thin-skinned, egomaniacal, amoral former reality TV star in charge of the nation's public health system at a time of a pandemic, that things would end in disaster? Who'd have guessed that? And, you know, Ali, the coronavirus is a natural disaster. It's not man-made. But the response to it here in the United States, that disaster is purely man-made. And that man is Donald J. Trump. The testing situation has been, it's infuriating to see how few tests have been done. We're now ramping up tests. We're now seeing tests being done in the numbers that should have been done weeks ago, Ali. Just some stats for your viewers. At the beginning of March, the United States had tested 1,000 people. Then it went up to 10,000 people in mid-March. Now we've reached more than 100,000 tests. 1,000 tests at the beginning of March. At the same time, South Korea had tested 100,000 people. South Korea and the United States got their first COVID-19 case on the same day back in January. The difference is the South Korean government, Ali, took action, got its private sector to start making stuff, start testing. The United States was led by Donald Trump, who told us it was a small problem. It would go away soon. It was totally under control. It was one guy from China. It would miraculously disappear. The warm weather would get rid of it. It was mild. It was the equivalent of the flu. It was completely shut down. And that was the stuff he was saying in public. In private, as we now know from reporting in the Washington Post and elsewhere, he was ignoring warnings from his own intelligence agencies in January, telling him this was a problem. His health secretary called him in January to try and talk COVID-19 with him. And he only wanted to talk about vaping and when flavored vaping would be back on the market. In fact, he later rang his health secretary to complain when he was in India that the CDC was spooking the market by talking about when, not if. So as one epidemiologist told me recently, Ali, this president does have blood on his hands, I'm sorry to say.
Lipi, Roy, last night I had a conversation with Brigadier General Russell Honore. You know, there are moments in history that you think about, whether it was 9/11 or the last recession or Katrina. A lot of people talk about Spanish flu, the Depression. There are lots of moments that we're comparing this to. But I remember in 2005 during Katrina, when everything seemed to be going wrong, they sent Russell Honore in. He was chomping on his cigar. He landed in Louisiana and basically got the thing in order. He was saying last night, he said, there's a lot of things we can do right now. There are nurses and doctors in training who we can deploy. There's the Defense Production Act that can cause the government to get involved in the business of manufacturing these supplies that we need and the equipment that we need so urgently through private companies. There is the deployment. The president said the other day, we're not a shipping organization, but in fact, he made the point that the Army Corps of Engineers and FEMA can actually ship and distribute things, determine where needs are in a more essential fashion. The fact is there seems to be a very desperate need for a federal government response. We've had governors responding with shelter-in-place orders and efforts to get this kinds of stuff, but we need a federal response.
So 100% correct. I just want to follow up and just drive home a point that Mehdi made, which is this idea of this free-for-all, whichever state can get these necessary supplies. Can I just tell you, as a doctor, and I'm speaking on behalf of many of my medical colleagues who have been texting and calling me every single day about real-time situations happening at their hospitals nationwide. This idea that only certain hospitals and certain locations will be getting life-saving supplies is beyond unethical and egregious. I just want to make that really clear. As doctors, we really have one agenda, and that agenda is the health and safety of our public. I saw your interview with Lieutenant General Russell Honore, and can I just tell you, when I was a second-year medical student at Tulane University in New Orleans, when Hurricane Katrina struck, I saw, and my classmates all saw, Lieutenant General Honore's face on TV every single day. And when I think of that man and what he has done, I think of what leadership really is. You know, to me,
Yep.
and based on my experiences from working in homeless shelters to working at Rikers Island to working in addiction treatment centers, my observation in terms of what a true leader is, I have my own little mnemonic for it, URI, which in this case does not stand for upper respiratory infection, but rather a leader is somebody who unites, who reassures, who inspires, and then the D for that is also somebody who advises, whose advice is deeply rooted in data and science. You know,
Yeah.
and yeah, you're absolutely right. At this point, you know, our medical
That's
profession.
certainly not the president.
Oh yeah, our medical. I mean, I'm really thinking about my med school classmates and fellow residents, people that I love, and many other doctors and nurses and healthcare practitioners and nurse practitioners and respiratory therapists. This whole team of people who are required to take care of one person. I'm thinking of these frontline people who are truly
Yep.
risking and compromising their safety because we are lacking basic items in the richest country in the world. I think that's egregious. So yes, I agree with what Lieutenant General Honoré was saying in terms of really getting people at the federal level involved, Army Corps of Engineers, the military, to help with the logistics. He kept talking about the logistics,
Yep.
and that's what we need.
That's
so
right.
the doctors and the nurses can focus on direct patient care.
Dr. Roy, please convey our deepest appreciation on the part of the nation to you and everybody in your profession, because you're going out there risking your lives. You will be keeping us safe. Many of our lives will be saved by you and your colleagues. So just make sure all of them know that this is a service that they are providing that we are deeply appreciative of. And thank you for your time as well. We'll be depending on it daily and weekly. Dr. Lipi Roy, Mehdi, stick with me for the rest of the show.